From my perspective, public partnerships is a partner with the state. Very specifically, they were a subcontractor for us to do financial management services. Years ago, when self-directed services were being initiated, it was determined that, and at that time it was primarily states who were implementing these programs, that states were not the experts at managing the payroll and tax reporting and just the communication with our members as employers. That's not the specialty of the state departments of human services. So I saw self-directed services working for families in a number of ways. I had the opportunity to work, if not directly, but at least indirectly with the 1,000 clients that were on our services. And through my staff and through my direct contact with our clients, I heard stories from numerous stories of people being able to avoid going into a nursing facility or coming out of a nursing facility and being able to stay at home because they were able to hire their own caregivers that were going to be more dependable. They were people that they trusted and actually received the type of care that they needed. There were many husband and wife combinations where we have one or both on our services, and without the additional support, the other spouse would have had to quit work and stay home. And so we were keeping families together. We were keeping people in their home. The role of public partnerships oftentimes was underappreciated by our members because they don't see all of the other things that were going on. But there was a lot to the payroll management, assisting our members to hire their employees, dealing with all of the personnel paperwork that goes along with that. And then there's a lot of behind the scenes things that I appreciated as a manager, being able to get the data back from public partnerships on what was really a massive amount of interactions and financial exchanges between the state billing, the federal and state tax authorities, and then also between the public partnerships as the payroll agent directly to the members' employees. With public partnerships, we were able to, with the same number of staff on the state side, be able to grow that at a 30% rate every year that I was there. And without any additional staff on the state side, without any additional program dollars going into it from the state side, to still be able to manage a greater number of members, be able to serve. We went from serving 500 members to well over 1,000 members and close to 1,000 employees by the end of that. That was not manageable at the state level. Managing that growth was not something that we could handle. So any program that is growing could find a great partner in public partnerships, because if the state is interested in making sure this option is available to more people, public partnerships, at least in Oklahoma, was there beside us anytime we were introducing a new initiative to make sure that people were aware or more educated about the service.